Well, thank you, everybody, for coming tonight. I think we have a terrific program for you. Appreciate your being here. And my name is Dave Kemp, and I have the privilege of serving as president of CurePSP. And I'm going to keep my remarks brief because I know we all want to hear the experts on the subject. And I wanted to, first of all, give a big shout out to Dr. Robert Stern of the Boston University School of Medicine, who played the pivotal role in pulling this panel together. And also wanted to thank Dr. John LaPook, who took a time out of his busy schedule to moderate the proceedings. We really appreciate that. I also wanted to recognize our panel all the way from Chicago. We have Kim and Mike Adamle, and among many other things, they've started the Mike Adamle project, Rise Above, and they can tell you about that later. Dr. Sam Gandy from Mount Sinai, and Dr. Gandy is one of the world's leading experts in head trauma. And we have Lisa McHale from the Concussion Legacy Foundation. Lisa, and they're doing tremendous work, as a lot of you know, in terms of educating people to the dangers of concussions, especially within sports. And we have Karen Kinzle Zegel, and Karen started the Patrick Risha CTE Awareness Foundation in honor of her son. And I'd also like to recognize the host committee, and it's headed by Dr. David Greer, who's the chair of the Boston University School of Medicine Department of Neurology. Really appreciate your work. CurePSP is the foundation for prime of life neurodegeneration. And this is a spectrum of diseases that, unlike Alzheimer's disease, typically onsets in middle age, and in the case of in the case of CTE, often earlier in life. And unfortunately, at this point, we have no effective treatment, and we have no cure. But there is hope, and we're proud to partner with Boston University School of Medicine in raising funds to support their research. The BU School of Medicine is the leading research center for CTE right now in the world. And there's good evidence in research that if we did find treatment for CTE, that we would also have treatment for other related diseases that exhibit the same pathology. So in closing, I'd ask everybody, and I have to do the ask at the end of every talk, I'd ask everybody to give generously to support Dr. Stern and his colleagues in their work through the CurePSP Boston University School of Medicine CTE Research Initiative. And with that, I have the privilege of turning the proceedings over to Dr. LaPook. Thank you very much.
Thank you. You can hear me all right? Even those all the way up in the balcony over there? No. See, the people watching this on the web don't know there's no balcony. There's no balcony there. Anyway, thank you very much for inviting me. And you know you're getting older when one of your former students, that would be Dr. Gandy, has become a real big deal and a world's expert. And it's okay, I love it. I love the feeling of having a student so excel. And I have to share something personal here, which is, you know Sam Gandy, the researcher, and maybe you know a little bit of his clinical side, but I know Sam Gandy, the clinician, who just a couple of weeks ago, as one of our mutual patients, had his final days, somebody with Alzheimer's. Sam was nothing short of spectacular, just the epitome of an empathetic, compassionate, caring meticulous, and effective doctor. So I've never seen so many texts in my life in 1 hour as when things started to turn. I happened to be offline at that point. I came back and it was because it was like 5 in the morning. Yeah, and I woke up that morning and there were like 14 texts, and he was texting with this man's wife. And I can't tell you, in the middle of all the research, in the middle of the science and the test tubes and the artificial intelligence, to have the hand of somebody who's truly old school empathetic. He's new school brilliant with the latest research, but you need that old school, hands-on, old-fashioned doctor, and I couldn't be more appreciative of it. And with that, I'll turn to introducing Robert A. Stern, Ph.D., professor of neurology, neurosurgery, and anatomy and neurobiology, the clinical core director at BU, Boston University's Alzheimer's Disease Center, and the director of clinical research, BU CTE Center, Boston University School of Medicine. I got to tell you, so I'm the chief medical correspondent at CBS News, and we've done a bunch of stories on CTE and various related disorders, and we all, Dr. Stern is our go-to man. We all know what he's done. It's monumental. And right now, many of you may not know that if you go to New England Journal's main page, he's it. It's about as high an honor as you can have, right? He's on the home page of the New England Journal because he just came out with a very important article that I suspect I can't steal his thunder on, but it's a very important article.
I'm going home.
And the murderer is it's a terrific article and very important incremental article about how you diagnose CTE. So with that, I will turn it over, and then later on we'll have some back and forth. So, welcome aboard.
Thank you, John. It's truly an honor to be introduced by you. It's also an incredible honor to be here, and I want to thank Dave Kemp for all of the incredible support along the way getting here, and for all the amazing work that CurePSP does for so many people in need. Dave mentioned that if our work with CTE can lead to a treatment, we may be able to help PSP. I look at it just the other way around, that I'm hoping that all the wonderful work that's being done on PSP because of CurePSP Foundation's efforts will hopefully be able to make some additional steps. All right, this is why you're all here.
Because me and my clique, we don't give a fuck.
Right. Have to start with some football. All right, I'm going to start talking about concussions just for a little teeny bit, just so we're all on the same page. So concussions occur when your brain gets jostled inside that hard skull with some rapid acceleration and deceleration. And all that results in this stretching and shearing of the axons of the nerve cells, creating this temporary disruption of their functioning and release of potentially toxic things. And when all that's happening, there are some symptoms and signs of concussion. That's a concussion. And here's a full, very important disclosure. I don't know much about concussion. People think I do. My area of expertise, if even that, is neurodegenerative disease. And here's a bigger disclosure. I'm actually not very concerned about concussions when it comes to these later life problems like CTE. So what do I mean by that? Well, think about the proverbial tip of the iceberg. Well, the tip of the iceberg of this larger entity that we're going to refer to as repetitive head impacts is a big traumatic brain injury, a moderate to severe traumatic brain injury where the person's unconscious and there's huge injury to the brain and the person likely has residual problems for the rest of their lives. Those are really rare and they're so important and devastating. But what we've all been hearing about so often are concussions. Those bigger hits that lead to symptoms. We hear about it all the time. We talk about it all the time now. There's concussion this, there's concussion that. But that's just on the surface. Because what's underneath is something we refer to as subconcussive trauma. And by that, I mean an impact to the brain with adequate force to have the same type of effect on brain functioning as a concussive type of injury, but without those immediate symptoms of concussion. And some combat military service members, many contact and collision sport athletes are very prone to these types of repetitive subconcussive injuries. Think about a lineman in football. Every play of every game and of every practice, what do? They hit their heads against their opponent. And inside those very large, hard plastic encasements is a very hard skull with a jello mold consistency brain inside surrounded by spinal fluid. And every time that happens, that brain's moving around quickly. So what I've been doing for the last 10, 11 years has been trying to come up with some type of answers, often more questions, about whether concussions and these subconcussive hits lead to later life neurodegeneration. Oh, you're not hearing the volume? There we go. Well, you get the idea. It's an interesting sport. The goal of that sport is to induce brain damage. When it comes down to it, that's what it's about. So when we think of, you know the guy on the right, who knows who that is? What's his name? Nope. Who was that? Give her an extra glass of champagne. Yes, it was a trick question. It was Cassius Clay before he changed his name. So now we all know that inability to get words out, the kind of blank stare. Oh, no, that's Bush. So we've spoken about, we've heard about, we've known about the long-term consequences of repetitive head impacts in boxing for an awful, awful long time. In fact, in 1928, our beloved JAMA, the Journal of the American Medical Association, had an important landmark paper called Punch Drunk, in which Dr. Martland described the later life consequences of getting your head hit as a professional boxer. And he described in such medical wonderful terms as goofy and slug nutty. And then he described later on they required institutionalization in an asylum because of dementia. The term dementia pugilistica was used soon after that, the dementia of pugilists, of boxers. And then the term chronic traumatic encephalopathy, or CTE, was actually first coined in 1940 and then used more routinely since the late 1950s. But it wasn't until 2002 when a beloved American football player, Mike Webster, who played for the Pittsburgh Steelers, died tragically after a tragic end of life. And his brain was examined by Dr. Omalu, who, with some colleagues, looked at the brain tissue and realized that Mike Webster, as a professional football player, had the same thing those boxers had. He had CTE. So what is it? CTE is a neurodegenerative disease, the same thing that we used to refer to as dementia pugilistica. It's associated with a history of getting your head hit over and over again, those concussions with symptoms, as well as the subconcussive trauma without symptoms. And that repetitive head impact exposure seems to start a cascade of events in the brain that eventually leads to an accumulation of an abnormal form of a protein called tau. That tau protein we all have in every brain cell, we better. It's a huge, important part of the healthy functioning of our brain cells. But in many disorders, including PSP, including Alzheimer's disease, including frontotemporal dementia, corticobasal degeneration, several other disorders, this tau goes awry. And when it goes awry, it does bad things. And in this case, it seems to go awry due to those repetitive hits earlier in life when people are getting hit from, in this case, football. And that abnormal tau protein slowly but surely hurts the way the brain cells function and eventually lead to the destruction of brain tissue. And then it continues to progress well after the head stops getting hit. And as more and more brain tissue gets hurt, the symptoms get worse and worse. And similar to those other neurodegenerative diseases, such as Alzheimer's disease, it has this tau change, but it's a unique disease. These symptoms that I'll talk about, as Dave Kemp mentioned, often begin in the prime of life. And so it's considered as one of these very important prime of life diseases that the CurePSP Foundation has really pulled together to show how devastating these types of neurodegenerative diseases can be, because they don't just affect people when they're in their 80s and 90s. They can affect people in their 30s, 40s, 50s, 60s. And so the neuropathology of CTE, like other neurodegenerative diseases, even in 2019, CTE can currently only be diagnosed post-mortem through a neuropathological evaluation. The first large case series of this type of description of what's going on in the brain after death was done by Corsellis of boxers in 1973. And my colleague, Dr. Ann McKee at BU, has now examined more brains with CTE than any neuropathologist on the planet. She runs the largest CTE brain bank. It's the VA for Veterans Administration, BU, Concussion Legacy Foundation brain bank. And what she has described and defined at this point is a type of lesion in the brain of this tau protein that is unique from any other disease or condition. What you're seeing in front of you, the brown stuff, is after a special stain has been put on the brain tissue, and it turns brown when there's this abnormal tau. On the left, you see the abnormal tau focusing around a blood vessel. That's the white hole in the middle. And on the right, it's at the depths of the cortical sulcus. That's the valley of the brain kind of rim. Here you can see a slice of brain tissue, not under a microscope, after it's been stained, and you can see where that arrow is and all those other brown spots. That's the depths of the sulci. That's the valleys. And that's where the stress and strain seem to take on the most at an impact, especially when someone's wearing a helmet and they're getting hit. Let me make it a little kind of human. This goes way back, and I still use this example because it was so descriptive. This was the first brain donation to our center of a former NFL player. It was John Grimsley. John Grimsley tragically died at age 45. He was a very successful, well-known linebacker, played for the Oilers predominantly. He was a Pro Bowler. And after he retired, he was a successful professional hunting and fishing guide. And I say that because he knew his way around firearms. But sadly, for the 5 years prior to his death, he started having a real change in who he was. His personality changed from a nice, calm, sweet kind of guy to someone who had this incredibly short fuse, flew off the handle. He also started having awful short-term memory problems, where he couldn't remember things that were said to him the day before. And sadly, one night he was home alone cleaning his guns, and he accidentally shot himself in the chest and died. There was an investigation to see if it was suicide or not. They determined it wasn't. What likely happened was he either forgot to take the ammunition out before cleaning, or he did the wrong steps. His wife, Virginia, donated his brain to us, and Dr. McKee and her team looked at it, and you can see all that brown stuff. That shouldn't be there. On the top is without a microscope. On the bottom, you can see these brown neurofibrillary tangles and other tau types of lesions. Let's put it in perspective, though. On the left is a healthy brain, a 65-year-old healthy brain. That's the way it's supposed to look. Greater perspective, this was the brain of a 73-year-old world-class boxer who had been institutionalized in a nursing home for years with a diagnosis of Alzheimer's disease. But, he was a boxer. People thought he might have been punch drunk, dementia pugilistica, and sure enough, he did have CTE. But it's not just football players. It's also not just pros. CTE has been found in all kinds of individuals whose brains have been hurt and hit repeatedly, down to age 17 all the way up to the 90s. And what we seem to think about the clinical manifestation of this disease is that it has these changes in mood, depression, the lack of caring and motivation or apathy, anxiety, agitation, rage, but also changes in behavior. That short fuse I was describing in John Grimsley, or behavioral dysregulation, an inability to control one's actions, impulse control problems, aggression. And then also changes in cognitive functioning, this really bad short-term memory, the inability to learn new things. So there's rapid forgetting of information, as well as executive dysfunction, meaning things like poor planning and organization, difficulty doing more than one thing at a time, having poor judgment, decision-making. And then if it gets bad enough, as someone lives older with it, they become demented. They have dementia. And so often people are confused about the difference between dementia and Alzheimer's disease. People always think they're the same thing, but no, dementia means that someone has cognitive impairment that's bad enough to get in the way of daily functioning. That's all dementia is. It's caused by many, many different things, many different neurodegenerative diseases. CT is one of those diseases, like Alzheimer's disease, that eventually, when enough brain tissue is destroyed, that memory and other cognitive difficulty gets bad enough to get in the way of routine independent functioning, and we call that dementia. Some people also have motor impairment, a Parkinsonism, the shuffling gait, the tremor, perhaps difficulty speaking. So we've learned a lot, especially through my colleague Dr. McKee's work looking at the neuropathology, and there's been this incredible growth in our, well, at least in our media attention. Thank you, John. I mean, it was really cool. I got to be on 60 Minutes. That's neat. But science doesn't work that fast. In the best of circumstances, science is a very slow, iterative process. So I used to say that we were at the infancy of our knowledge of CTE, but actually, things have moved pretty darn quickly, considering how slow science usually does work. In the past 10 years, look at the incredible growth in the number of publications about CTE. And for those of you who think that BU does most of that, no, 88% of those publications were not from BU. There's a lot of incredible knowledge that is being gained every day. And so now I think we're in the toddlerhood of our understanding of CTE. And so what do we need to do next? We must be able to diagnose CTE during life, or get pretty darn close to it. Because if we can do that, we can answer some very important questions that still remain really unknown. Like, how common is CTE? We might be able to figure out why some people get it and some people don't. What are the actual risk factors? What is it about getting your head hit over and over again? What about genetics that might increase or decrease one's resilience for it? And if we can do that, then we can also hopefully be able to start some clinical trials to treat or maybe even prevent the symptoms of CTE. And so to do all of that, there's one very important thing that we have to be able to get to. Because if you remember that clinical description, those are so nondescript. It's not just CTE that has all those different types of problems. So we have to be able to figure out a way to objectively measure the changes in the brain through objective biological tests or biomarkers Because similar to other neurodegenerative diseases, the use of objective measures of what's going on in that brain, in addition to a really good clinical evaluation, will lead to accurate detection and diagnosis of CTE during life. And so the first step to do that, this is a really important one, develop a great acronym. You heard it here. So look at this. You've got to understand, Nobel Prize worthy acronym development. It was good enough to also get us a grant from NIH several years ago. We did a study where we had 100 former NFL players, 30 same-age men who didn't hit their heads, and they came to Boston. We did all kinds of things with them over a 2 to 3 day period. And through all that, we've started to now have some preliminary understanding of what we might be able to use for, in this case, neuroimaging types of biomarkers. In this case, all different types of what we call fluid biomarkers based on blood tests or cerebrospinal fluid measures. But the ideal, perhaps the gold standard, would be to have a PET scan. A PET scan that is able to take a picture of radioactivity once a compound gets into the blood, crosses into the brain, and attaches to that abnormal tau protein. And if we could be able to see pictures of where in the brain and how much in the brain there is this abnormal tau, we'd be able to really get that first big step toward being able to detect and diagnose CTE during life. And so there's been this what's called a tracer or a ligand or a compound that is specifically designed to attach to the abnormal tau protein. It was developed initially for Alzheimer's disease. And so the question is it good for things like PSP? It may not be. But is it good for CTE? It actually may be, because we're learning more about the molecular structure of the tau protein in all these different diseases. And so the first case that was really shown to have this abnormal PET scan picture of tau was done by our own Dr. Gandy and his team, where they looked at a 39-year-old former NFL player who was very symptomatic, and they gave him this new tau PET scan as well as an amyloid PET scan to detect the type of other protein that goes awry in Alzheimer's disease, the beta amyloid that creates the plaques in Alzheimer's disease. And what they found was, yes, in this case of this former NFL player, they could see the abnormal tau exactly where you'd expect it to be in CTE. And there was none of that amyloid protein. And so this jumps to what Dr. LePuc was talking about, where he stole my thunder about the New England Journal of Medicine. We just published this on the last, came out online like 3 weeks ago, and it came out in print last week, of a larger case series of this where we compared 26 former NFL players and 31 same-age controls, all middle-ish age, where they received these two different types of PET scans. And lo and behold, it seemed to work. Everywhere you see the bright colors on those slices of brain, the brain scans, is where there's this abnormal tau being detected. And if you kind of pull it all together in a fancy kind of model, these are the areas where we were able to see this abnormal tau while people were living, these former NFL players were living, and it's in the same places we would have expected it based on the neuropathological findings. On the bottom, this is the more important finding here, we had a direct association between the number of years that these guys played tackle football across their whole life, not just in the pros, and the amount of abnormal tau found in the brain while they were living. And so the next step in biomarker development, come on, make another acronym. Very good. So we made another acronym. It's not as good, but it made us $16 million in grant money from NIH, and it made me the most fortunate person around to be able to collaborate with some giants in the field, Drs. Cummings, Ryman, and Shenton, and 50 collaborators from all around the country in 10 different research institutions. And we're doing this incredible project. I'm not going to go into all these details, these goals of what we're doing, But we're just about done with our first 3.5 years, where we're going to be finished collecting all of our baseline data by the end of 2019, and we'll be able to start answering some of these questions. And so once we can diagnose CTE during life, we will be able to start some clinical trials for treatment and some type of intervention. And if we can detect it early in the disease course, prior to the symptoms, we can conduct clinical trials for prevention. And if that doesn't work, maybe we can learn from our animal friends. In the back, if you can't read it, it says, I read that story about dementia and former NFL players. Maybe we should reconsider this. I get to tell some bad jokes, but the people who do all the work are these wonderful people, colleagues and staff and trainees of mine at BU. And again, thank you very much for having me here.
I'm not sure how we're both going to be mic'd with it. So I'm supposed to do now 5 minutes of sort of like a quick follow-up on this. So why don't you stay?
I'm mic'd. We're both mic'd.
Can you hear me from there, even without that? Okay. So I guess we can let the congregation be seated. But I have to point out something. So I said that Sam Gandy was old school, and that was a really good thing. But he may have been trumped in the old school. Is this an IBM ThinkPad that you're using?
Yeah.
It's
not IBM anymore. It's Lenovo.
Oh, it's Lenovo.
Yeah.
Okay. Dry gasoline? No, that's Sunoco. Okay. How many people in this audience, you don't have to raise your hand, but have somebody in their life who is suffering from one of these conditions that have been referred to? Okay, so probably about half, or a third to half. So this is all amazing and cutting edge, but for a lot of people, they're thinking, my grandkids or my kids are participating in fill in the blank. Football, ice hockey, soccer, on and on and on. So one of the big questions is, and I guess you're working with the NFL, right? But not every sports organization has really been all in terms of cooperating with trying to figure out risk factors and who's at risk and stuff. So number one question is, in your study about baseline, how early did you go? Did you study a 15-year-old, a 13-year-old? What was the arc of that?
So in our current studies, they only go back to age 40. Mm-hmm. We have other studies where we look at age 18 and above. But then what we've done is we've looked at large numbers of former football players and found out about when they started to play football. Right. And we've done a whole variety of studies trying to see if there's some type of relationship between the age of first exposure to these repetitive hits and later life problems, including cognitive impairment, mood changes, behavior changes, as well as CTE pathology. And what we found in study after study is that the earlier someone starts getting hit, the greater the risk for later life problems. And there seems to be this kind of threshold at age 12, that if people start getting hit before age 12, it seems to increase their risk for these later life things multiple-fold. And that actually has some rationale to it, because between the ages of around 8 and 12, the brain's going through this incredible amount of kind of neurodevelopmental maturation. It's going through just incredible growth. And if you get in the way of that growth by hitting it repeatedly, it may then have later life consequences. We know that other things that happen to the brain during that time period take longer to recover from. In this case, what we've seen now in study after study, that there are long-term problems. We also have seen in other people's research where they put these accelerometer gizmos in helmets to count the number and types of hits that take place. There was one very scary study of 8 to 12-year-old Pop Warner kids. And all of them had MRIs before the season, MRIs after the season. And then they counted all the number of hits that the kids got during the season. And they removed anyone from the study who had a symptomatic concussion. So it was just a study of routine play. And what they found was a very strong relationship between the amount of hits and changes to the white matter of the brain.
So have you gotten to the point, belly and science, intuition and precision medicine, where you would say, these are the sports that I would not have my grandchild participate in?
Yeah, belly and science is actually a really big deal. I used to only be a scientist. And my oldest kid played football. He was a wonderful football star, and I watched him on the sidelines from Pop Warner all the way. It was before we knew any of this stuff. And so now the science is growing, but the belly's also saying, does it really make sense? Does it make sense to put our kids in these big helmets that make it so they can't feel the pain they're supposed to feel? You know, human beings, we're supposed to touch the stove and not want to touch it again because they're hoits. But if we wear this big plastic helmet and a face mask and you hit your head, it doesn't hurt. And if you get hit over and over and over again, when you're 9 years old, 7 years old, and you're told the more you do this, the better it's going to be, that is just kind of bonkers to me when I think of all the other stuff that we all do as parents to keep our kids healthy. So now it's the science meeting the belly, and the belly's now able to say in public, finally, no, I don't think little kids should be playing tackle football. Little kids need to be active, though. They need to be incredibly active. They need to learn about team sports, individual sports. They need to do everything they can to kind of gain the confidence and the skills and the athleticism and not become obese. But we need to do other things besides hitting their heads repeatedly.
It's interesting, that point, because we know that, and probably most of you know, but I'll just point out that the helmets prevent fractures, but they don't do anything to prevent concussions or subconcussive injury or things, or the jello effect of things going around like that. It's interesting. We did a piece for CBS. We went to the University of Arizona, and they had these fancy schmancy helmets, and then they were also doing the biomarkers. I don't even know what the result was because it was still the beginning of it. But they did find out that about 70% of the hits were in practice, which was so duh. And so they stopped hitting in practice. You know, I mean, so there are some things. I'm also interested, but there's no time, in what are the things that are not intuitively obvious that are perhaps causing the CTE, things just in our daily lives that are not obvious. Okay, I'm getting hit on the head with a 2x4, you know. But that's for another time, because I need to move on. I think our 5 minutes or 12 minutes are up. So the next, I'm supposed to introduce everybody on the panel. So Sam Gandy. Come on it. Oh, you're already down. I'll read from here because your official stuff I may not know as well. Associate Director of the NFL Neurological Care Center at Mount Sinai, one of the world's leading experts on the effects of head trauma. Dr. Gandy also serves as Associate Director of the Alzheimer's Disease Research Center at Mount Sinai and is Professor of Neurology and Psychiatry at the Icahn School of Medicine at Mount Sinai. I remember when it was just Mount Sinai. Now it's just, these things keep getting longer. And he and I did a piece about Dave Herman, who was a right tackle for the New York Jets, 1969, and played the entire football game opposite Bubba Smith, and just kept getting banged out on every play, and every play for his whole career. And after of course, the Jets won. And after the game was over,
Jets won a Super Bowl?
16 to 7. I can tell you every score in the play. 16 to 7. And Johnny Unitas came in at the end and threw a touchdown. But I digress. Anyway, at the end of the game, he said in the locker room, who won? He had no memory of it. And then, of course, we interviewed him for the piece, and he had CTE. So, Sam, why don't you give a little spiel about what you're doing?
So as Bob mentioned, we've been involved in trying to make the diagnosis of CTE or support the diagnosis during life with biological markers, either imaging markers or markers from body fluids. And we've been looking both at a cohort of retired football players, retired NFL players, and former vets who've been exposed to IED blasts on the battlefields of Iraq and Afghanistan, because that also rattles the brain and also causes a repetitive brain injury. And the pathology of the football-related CTE is pretty indistinguishable from that related to being exposed on the battlefield. So it's all still the accumulation at the bottom of the wrinkles. You think of the brain as being wrinkled. It's sort of the bottom of the wrinkles that takes the brunt of the injury, as Bob was showing, and that's true in both cases, both situations. So we've been looking with PET scans, first excluding Alzheimer's disease, and then using new tracers to look at tau. We want to get to the point where we're able to do this at the individual level, and that's the challenge now. And so we've combined the brain imaging markers with at least one now body fluid marker that seems very sensitive, although not at all specific. And so we had our cohort of subjects in whom we were trying to match up who had the disease and who did not. We were able to use this. We sort of studied this blood biomarker blindly, and we're able to pick out the same subjects who seem to have the changes on imaging. So we need to do this in much larger studies, but I think the combination of molecular imaging and molecular diagnosis of blood biomarkers. I mean, basically what these blood biomarkers mean is that your brain is leaking into your blood, and you're able to detect it.
It goes to the CSF, the spinal fluid, then into the blood, or does it go directly into the blood?
It can go directly into the blood because you open the blood-brain barrier from the injury, so you don't need to go through the CSF.
So for people who don't know, or it's kind of sensitivity, specificity, so when you say the biomarker is sensitive, but it's not very specific, he means it's going to pick up the people who have the problem, but it's also going to have false positives. It's also going to have people who don't have the problem. So my question related to that is, does it make sense to have a two-step process, since you have the scanning, which is a much more, I guess, expensive process, have a baseline, highly sensitive but not specific biomarker blood test, and then the people who are positive, then they get the scan to see, well, who really has it?
Certainly once the scans are perfected enough to be able to make the diagnosis on the individual level, that makes sense. Now we still need to do group analysis to be sure of who has what. And we're not so sure without having both pieces of data. I think there will be more blood biomarkers, and there will be genetic markers, both of susceptibility and resilience, which is an important thing that I think that the Alzheimer world is now sort of turning its attention to looking instead, rather than looking at how things go wrong, rather to look instead at the molecules that help protect the brain. We've known for decades that you can have a head full of amyloid plaques and tangles, meet pathological criteria for Alzheimer's disease, and not be demented when you die. Maybe you would have demented eventually, but you're not demented. The brain with a certain amount of resilience can continue to function normally despite that burden of pathology. So I think that may be the next frontier in terms of trying to understand that, since we've failed so much at trying to treat the pathology after it seems to be too late.
So again, for people who may not know, about a third of the people over the age of 65 have amyloid, that gooey substance that causes, that has to be there for Alzheimer's. I won't say causes, has to be there for Alzheimer's. But yet they don't have obvious cognitive problems yet, and people are doing long-term studies to see, well, they had increased risk later. There's lately been a garbage collecting function for sleep that's been reported, so that you have all these toxins that develop, and why are we asleep for a third of our lives? I mean, that seems like a very drastic step for evolution to have taken, or the forces of the world to have taken. And it may be not just to sort of rest not to be running around, but actually lots of things, hormones are being replaced in your appetite and your immune function. But one of the things is that these toxins that build up seem to be removed. So is there some role is there a sleep disturbance that may happen in these patients that actually accelerates the problem? And is there some kind of sleep therapy that might be helpful?
Certainly, sleep and the pathology have a sort of mutually reinforcing relationship. There's a vicious cycle. You can start with bad sleep, accumulate pathology. The pathology then wrecks your sleep, and then this sort of gets worse in a sort of cascading fashion. I mean, basically, the function of sleep seems to be to sort of flush the toilet and get a lot of these toxins out.
That's new, right? That's a new.
This was
in the last decade.
Yeah,
right,
yeah, new in the last 5 years. This is it's very dramatic in terms of the effect that sleep has on purging the brain of these molecules that we've been sort of struggling with billions of dollars to move around. Really, all you need to do is take a nap, and it all comes out.
So when we're trying to get people in the audience to donate and get out their checkbooks and all that stuff, it's often things that are not intuitively obvious that end up being some key fact in science, something you totally didn't predict. You tripped over it after 27 blind alleys. And so that's why it's so important to support this. I'm going to move on to just in order here. So Lisa McHale, Concussion Legacy Foundation, and you are the director. This is how we would normally be talking. So how are you doing, Lisa? There we go. I think I'll do that. There we go. Much better. Is the Director of Family Relations for the Concussion Legacy Foundation, an organization dedicated to advancing the study, treatment, and prevention of the effects of brain trauma in athletes, other at-risk groups. Graduated from Cornell University, Big Red. Met her husband, Tom McHale, an All-American defensive end for the Big Red team. Ed Marinara, yes. He crushed us. I went to Yale. It was not a pretty game.
Good era.
Yeah. Tom played 9 years for the NFL's Tampa Bay Buccaneers. When he died in May of 2008 at the age of 45, he became the second former NFL player diagnosed with CTE by the research team at BU. So I turn it over to you.
Well, thank you, and thank you for having me. So my primary responsibility with the Concussion Legacy Foundation is to act as sort of the liaison between the research team at Boston University, Bob and his colleagues, and the families who donate their loved one's brain to the research. And that was not by design that I'm working there. My husband obviously became the second brain. Bob talked about John Grimsley. Tom passed away 3 months after John, and they share a birthday, in fact. So, interestingly for me, it doesn't seem that long ago that I had never heard of CTE. And despite being married to a man who played 9 years in the NFL, had never given a moment's notice to concussion. And that was all, of course, before I lost the absolute love of my life. The 25th of this month will mark 11 years since I lost my very best friend in the world. Tom was my husband of 18 years, and the father of our 3 boys were just 8, 10, and 14 when they lost their father. And I think, Karen, you can probably relate to this when I say, I so wish you all could have known Tom, because then you could fully appreciate what it is that I'm saying when I say that Tom is the last person you would have anticipated would die of an accidental drug overdose at 45 years of age. And prior to losing Tom, I remember often reading about former athletes, that are caught up in all kinds of difficulties and drug abuse and legal problems and financial difficulties. And I remember being very dismissive and thinking to myself, well, there's another pampered athlete who had been held high upon a pedestal his entire life and couldn't come down off that pedestal and face life once the money and the attention and the fame and the glory were gone. And I often think about how many other players have been similarly misunderstood because of this disease of CTE, because nothing could have been further from who Tom had been. So like you heard, we met as undergrads at Cornell University. Tom had been 4 years older than I had been. And he had actually spent the first 2 years of his career, his college career, at University of Maryland, where he was on full scholarship and earned his starting position on the defensive line. But as he later explained it to me, it was clear to him that he was there for one reason, and one reason only, and that was to play football. And Tom felt that he was not preparing himself well for life after football, which he knew full well, even if he were to make it to the pros one day, would still constitute the better part of his entire adult life. So he walked away from the scholarship to attend Cornell's prestigious School of Hotel Administration because it was more aligned with his childhood dream of one day owning and operating restaurants. And in fact, when he went to the coaches of Maryland to tell them he was leaving, Bobby Beathard was the head coach at the time. He said, "You're absolutely crazy. You're giving up an opportunity to play in the NFL one day." And Tom said, "You know what? If I'm good enough, they'll find me and I'll play." And apparently Tom must have been right, because he did play 9 years, 6 with the Buccaneers, 2 with the Philadelphia Eagles, and his final season with the Miami Dolphins. And quite frankly, he really could have played another year. He could have played longer. He had more than one offer on the table to sign a free agent contract to play a 10th season. But by now, Tom was starting to worry about, well, wait a minute, what about the long-term implications of my health? And so he decided, I've had enough. And he walked away from the game, which I think is pretty unusual, on his own accord. And, as far as any of us could tell, with absolutely no regrets. But what I loved about Tom is it was very, very obvious that he had this profound gratitude for having been given the God-given ability and the opportunity to play so many years at its highest level. And really with a real appreciation for the opportunities that afforded him in his later life, namely to own and operate restaurants in the Tampa Bay area upon his retirement. And he was exceedingly happy doing that. And we were exceedingly happy until he wasn't. And I honestly couldn't tell you when that began to change for Tom. I think, the symptoms of CTE tend to come on very, very gradually. It's very difficult, I think, to really describe or pinpoint when we began to see them. But it's uncanny almost the way you can get together with other people who have experienced this in a loved one and go down that checklist. Mood disturbance, check. Depression, check. Impulsivity, check. Poor concentration, focus, check, check. Shorter fuse, absolutely check. And with Tom, it thankfully manifested more as an irritability than aggression. But then again, he was very young when he died. And I know from my work with the hundreds of families diagnosed with this disease that we would have likely seen much worse. Excuse me. It's very, very difficult not to think about how different things might have been if we had known about CTE, if Tom had known why he was struggling the way he was struggling. And so I look with great admiration at what I see as sort of a model of that in Kim and Mike, and the strength and the courage with which they together navigate this world of living with this disease, and while providing hope and support for others. And so I just want to say one more thing about this disease of CTE, and I think what keeps me going and why I think have felt it's such a privilege to be a part of Concussion Legacy Foundation and work with this extraordinary group of researchers at Boston University is the fact that CTE is the one known form of neurodegenerative disease that is preventable. If we can avoid exposure to the repetitive head trauma, we can avoid our risk of developing this disease later in life. And so as a parent, there are no lengths I wouldn't go to protect my children from that. And it's a great honor for me to work for a foundation that is doing, and with a research team that is doing such great work in that field. So thank you very much for having me.
Well, That's very moving. Thank you very much for sharing that, and I'm sure it's not easy to tell that story.
Gets easier with years.
No matter how many times you've told it. So I have to ask, your 3 children, did they do any sort of sports where they could bang their heads?
They did play. My oldest has very significant special needs, so he is not an athlete. But the 2 younger, who at 8 and 10, were beginning to play Pop Warner football when their father died. Until I started to learn about this, and I think we convinced them to do. They are both lacrosse players with certainly exposure to concussions, but not the same kind of repetitive brain trauma. So I'm grateful that I learned about this when they were as young as they were.
You know, I remember at the time, even in the 13 years that I've been at CBS, can you believe that, Amy? Amy's been there for years. Turn the 13 backwards, right? She'll be turning the lights off, she will. But we can all remember when we estimated the incidence of autism as 1 in 160 or whatever it was, 168. And now it's gradually came down, now it's 1 in 59 or something like that. Do you think, you mentioned you didn't even know about CTE, and do you think that we're just seeing diagnosing the more serious people, and that really there's a spectrum, just like with autism spectrum disorder, where, boy, it would be nice to identify those people, right? Do you think they exist?
Yeah, I do. And interestingly, when Bob was talking about age of first exposure, my husband began at 8. And by age 45, he had very advanced disease. He had stage 3, with 4 being the most advanced stage. And I think we see that a lot. I think that's why we see very, very symptomatic people in their 30s, 40s, and 50s. They tend to be the ones who started much younger, whereas some of the older gentlemen may have played many years of football, but even families may describe them as being, relatively asymptomatic, and I think there's something to that.
I do want to throw out there before moving down that, with more and more parents, I think, of people who can afford to go to college saying, you know what, I'm not going to take that route of scholarship, sports, do you wonder about the socioeconomic, racial switching of this problem to...
It's a huge issue, and it's one that we can't just move forward without doing something about. For so many people, getting that scholarship is not only a way to get to college or maybe get to the pros, it's a way to maybe survive and live, to get out of the kind of death, the likely death that one will meet if you continue to stay on the same path. And unless we have some type of alternative for kids who don't have the privilege to get to school without that scholarship, who get to school without other activities or interests, we're going to have this huge divide of who's going into football. Similar to, I think, what might have happened in boxing over the last several decades. And we need to do something about that.
So that's a huge point, and I want to just stop and think about it, right? And when you hear about proposals to have scholarships. I mean, NYU Langone just made tuition for medical school free, and there's been a lot of discussion about moving that down because, after all, if you don't have enough money to get through junior high school, it's not going to help you to be able to have a free medical school ride. So I think that is something, when you think about unintended consequences.
It's a big deal, and it's already showing its effects in that flag football is a really awesome alternative for kids at this point. Yeah. And yet there's studies now that show that when you look at socioeconomic levels of communities which have flag football options compared to those that don't, it's the much higher SES communities that have flags.
Well, you can't imagine the slow motion replay of me pulling the flag out of the thing, as opposed to the bash. I mean, what are we evolutionarily programmed to want to watch? But I digress yet again. Okay, so we'll move on to Mike Adamle and Kim Adamle, and I'm just going to give a little spiel. And Mike was diagnosed with probable CTE after a great career in football and subsequent renown as a broadcaster, of course. He started at Northwestern University, where my son Noah graduated last June.
Oh, wow. Congratulations.
As in all, he is now an actor living in New York City.
Wow.
#full nest. Mike's not living with us yet, but my son Noah is. Anyway, he started Northwestern University as an All-American fullback, was Big Ten MVP in 1970, no small deal. That's a big deal. Subsequently played in the NFL for 6 years. I certainly remember that with the Kansas City Chiefs, New York Jets, and Chicago the Bears. And after retiring from football, he joined NBC Sports, of course, was a studio host, sideline reporter, was involved in all sorts of things, the Olympics, and he's now exhibiting some progressive symptoms. And Mike's wife, Kim, is an educational consultant, family educator and coach, school psychology trainer, as well as assuming primary responsibility for managing their family, which includes 2 daughters who live at home. And I will leave it at that and turn it over to you. Why don't we start with Kim?
We were going to do it the other way.
Oh, no. Why don't we start? I changed my mind. Why don't we start with Mike? Whatever you want to do.
Before we forget, you've got to tell your Bubba story.
Oh, okay.
Oh, Bubba Smith.
Yeah, since you brought him up,
It's a great name, isn't it?
Bubba Smith.
One of the greats, like Tom Tresh.
Well,
These great sports names.
Back in 19, and it ended in 75, they had something called the College All-Star Game. It was held at Soldier Field every year, and it had a great history, 50 years of the College All-Star Game. So I was an All-American that year, and I was on that team, and we were playing the world champion Super Bowl Baltimore Colts, who had Johnny Unitas and Tom Matty and our good friend, Bubba Smith.
Yeah.
Now, our team had like 6 guys who are in the NFL today. I mean, our quarterbacks were Archie Manning, Jim Plunkett, Dan Pastorini, Joe Theismann, me, Riggins, John Brockington, Jack Ham, Phil Villapiano, Jack Youngblood. I mean, this is like a who's who in the game. So, but every year the All-Stars for some reason got beat. I don't know what that was. So anyway, Blanton Collier was our coach, and Dan Dierdorf was our right tackle, and he said he wanted to tell Dan something, so he grabbed Dan by the shoulder pads, in a comfortable way, and said, Dan, you're going to be one of the great offensive tackles in NFL history. Trust me. You're just really good. But you know what? You're not going to be able to take on, you might be able to hold Bubba Smith at bay for about a second and a half. And so what we're going to do is we'll let Adamle, stay in the backfield, and he'll cut him when he's down. So first play from scrimmage, Jim Plunkett goes back, 1001, 1002. Bubba beats Dan Dierdorf, but I cut him, and Bubba's on the ground, and Plunkett gets the pass off. About 4 plays later, Jim goes back to pass. Dan's holding up Bubba, 1001, 1002. He's got a free pass to Plunkett, but I cut him, and he's still looking around like this. So this happens again about 10 plays later, and finally Bubba has caught on to everything. And so I was there at his knees, and he picked me up like this. And the guy was 6'7", 300 pounds, and he had me like the jacket like this, And I'm not making this up. I couldn't possibly make this up. And he goes, "You little men defender," change the words there. If you do that again, I'll bite your head off. Funny, the brain stuff. I should have been. I said, Bubba, if you do that, you'll have more brains in your stomach than you do in your head. And he threw me down.
Ooh, that's not bad.
And the fact that I could tell you this story is exactly why we all played football. Because I've got a million of these things, from Dick Butkus stories when I was with the Bears, great Joe Namath stories when I was with the Chiefs.
So, Mike, how much did that contribute, right? Because I remember at Arizona, the same thing with Dave Herman.
Right.
They didn't want to tell the coach that they got hit.
No.
They didn't want to tell the coach they had a concussion.
No, that was
hit in the head.
The red badge of courage. The other thing was I was a backup to Riggins and Emerson Boozer back those days, but I was the team captain of the special teams. And on kickoffs, there is, as you wait for the kickoff to be, you got a guy in the middle. There's 3 guys that protect the return man, okay? And their job is to fend off all these crazy kamikaze people who are blowing up the wedge and everything like that. So our special teams coach was a guy named Buddy Ryan, who was the Bears Super Bowl coach, defensive coordinator then. and he loved it when. So a friend of mine, his name is Lou Picone. He was L1, and I was R1 on the kickoff coverage team. All 11 people coming. It looked like the Ben-Hur. And then, so he was the left guy, I was the right guy, and the kickoff, we ran head over heels. We went over the wedge, we just dived over, and somehow we knocked the guy down. It was like crazy. And then we go back to the sidelines, everybody's patting us back. Whoa, way to go, nice hit like that. So Lou and I were, you know, poor by all standards back then. So we did anything we could. But we said, let's take the, you know, we might have some funny games that we can put Nintendo on it. So before the games, home games, we'd paint a rising sun flag on our chest. And we had a little bottles of sake, and we went, banzai. And we go out there, and we did it all the time. But nobody thought anything about this. You know, nothing, not a darn thing. And gosh, again, it's just about the sad thing that I see and Kim sees all the time is the guys who are removed from the game. But they didn't make any kind of money. Their pension plan is the worst in the national, in all sports. It's horrible. So a lot of these people have nothing to fall back on. And 2 years ago, my wife and I, Kim and I, were at a funeral for a dear friend of mine and ours. And his name was Tom DeLeon. He was center for the Cleveland Browns when they had the cardiac kids and Brian Sipe and all those guys. But he was an all-pro center for 11 seasons. And nobody got hit in the head more than centers did, because back then they could have, you know, if you got a guy like Mean Joe Green, they'd put him up right on the guy's nose, and as soon as the guy hiked the ball, the guy would take his forearm and knock the guy silly. Well, it took him a while to change that rule and throw it out completely. But
Dave Herman said that's what happened to him.
Really?
Yeah, he said that they changed the rule that he used to, every play he got hit in the head.
Yeah.
Every play,
Yeah.
every single play.
So anyway, I grew up with Tom. We went to high school together. And again, he played 13 years with, you know, the Cleveland Browns. And so we were married and got married in Park City, Utah, and that's where Tom and his wife, Mindy, and gosh, he had great kids. But towards the end, I mean, he was diagnosed with a brain tumor, back in like 2012 or something like that, but that helped. That was fine, you know, he had it in check. But eventually that's what killed him, and then they gave the brain to, you know.
So Mike, let me ask you a question, right? You're clearly very verbal, and you're very highly functioning. And I remember Sam teaching me that the smarter people are, the brighter they are, the higher functioning they are, the longer they can fake it and get around without anybody knowing. And it might be a little bit of a cliff finally when it starts to come down. But I want to ask you, Kim, from your perspective, did he fake you out for a while? Or were you able to pick up on what yeah.
Mike's a hard case because you can see how charismatic, dynamic he is. And this is what Mike did. And this is why Mike was successful both playing football. He's known for his antics in the locker room and, you know, his zest. And that actually is one of those tapes is how he got into broadcasting, NBC National. So he's this larger-than-life, dynamic character and a verbal genius. He still, his neuropsychological testing, you know, with the different subtests, his word knowledge is still superior. He's doing New York Times, you know, crossword puzzles still daily. So it's interesting, you know, how it manifests. So Mike has been able to hide it. And
Not surprised.
And a lot of the football guys, I mean, they have an aura about them anyhow if they're in the NFL. And so people were willing to overlook the quirks or the oddities or the things that didn't make any sense. I know for me, when I first got with Mike, he was 43, and I wasn't. I was in my 30s. Not that much younger. But so he was already older. He was established. I didn't know him when he was in football, except I watched him. Mm-hmm. I grew up in Ohio, Big Ten country, so I always knew who he was. But there were things that stood out that didn't make any sense, that didn't match this man that you just saw. And, this generous, loving, fun guy, not an aggressive bone in his body, but there were things that didn't make sense.
Like what?
I want to say this is one of the hardest parts of the other wives, and I talk about this a lot, is we feel an obligation to tell the truth. We need to, because people need to know how horrific this is. And we're hesitant to, because these guys don't deserve what they've been through, and as we tell the truth of how it manifests, this is not them.
You want to protect them still.
Not protect them, we want to honor who they are.
Uh-huh.
And so it's with that duality there. I say this, but I want to honor Mike and his courage in allowing us to share these parts of his life with right now. So in answer to your question, something that stood out is I remember I was living in Topeka, Kansas, and Mike was living in LA and traveled all over, and so it was a whole new world for me. He took me to, I'd never been to Vegas. When we were in the mall, Caesar's Palace and everything, and out of nowhere, he got frustrated over something and choked me, and I'm like, oh, my thing's up. And I was, can you hear me now? And I was shocked, and then just as fast as he let go, and he was gone. It didn't make any sense. Came out of nowhere. This wasn't Mike. He doesn't have an aggressive bone in his body. That happened a couple times in the first few years. Okay, so go ahead to now. We moved to Chicago, beginning of 1999. Mike has seizures on the air, and they take him to the hospital. They run a bunch of tests. We find out he has epilepsy caused by what the doctor saw, a lesion from the brain imaging that he attributed to a football injury. So now we were fortunate. We were working with a neurologist from 1999 on. And I mentioned I'm a school psychologist, and then at this time I was a university professor, so I'm training people in all of these tests. So I have a test library of over 500 tests. So I'm giving Mike ADHD, the Browns, adult scale, et cetera, all these executive functioning tests, because he was driving me crazy. And he was doing things that just didn't make sense. And I kept telling the neurologist, and he'd say, oh, Kim, you have to stop babying him. You have to stop doing for him. I'm like, no, you don't get it. So we were starting to see the beginnings of the behavior changes, the aggression. Then the executive functioning was kicking in now by this time. And then we hit 2005, and impulsivity, poor decision-making, business decisions, and hit 2008. We had the perfect storm of the stock market crashed, the housing market crashed, and Mike's brain crashed. And we lost everything at that time. But leading up to that, even when that happened, now there were some others who had committed suicide. There were some notable people now in the media. And since Mike was in the public eye, you can Google, his life was going out of control at this time, and still nobody knew what was going on. So yes, there were things, and when we would try to talk to people, it was difficult because, number one, they didn't know what was going on. There was nothing to attribute it to that they knew of. But when the wives would try to, because we were living with it day in, day out, crazy stuff, we would be discounted, either because they didn't know what was going on, but also because of who they are, this aura that I talked about. Many wives, other wives, they've had to call the police for the aggressive acts. And I know there's been times when we've had to deal with the police, and literally they'll come in all professional, then they see who it is, and all of a sudden they're slapping backs and they're sitting back and they're telling their own football stories, much like, you know, that's what they love about football. So again, in trying to get the word out and trying to get the help that we needed, doctors weren't hearing us, police weren't hearing us, professionals weren't hearing us. So this has been a long time coming for those of us, you know, in our generation. And so now we have the answers of what it is, and now we're just trying to find what do we do.
Well, thank you. I'm so grateful. And probably now would be a good time to sort of just point out, and it's a whole other seminar, the challenges for the caregiver. And especially somebody who knows so much as you do, and you're putting on these different hats. I'm going to take off the psychologist hat, I'm going to be the wife hat, I'm going to, you know, and, but I have to just, before we turn to Karen, how are you doing now? You can't leave us with, you crashed in 2008.
Me or Mike or?
But the two of you, I mean, in terms, you're living as husband and wife.
Oh, yeah.
You are, where do you
we were
live
remarried, and we live in Evanston,
just
just down from Northwestern, where Mike played.
And you guys have a life together,
And we are a team. That's how we function. You know, like when you started, I'm like, oh, wait, we talked about something different. I know that when Mike first told his story and the Concussion Legacy Foundation came to us, and they gave Mike the Courage Award and surprised me with the Caregiver Award. And the first thing I said is, well, I don't much like the word caregiver. You know, Mike and I prefer partner. We are partners in all that we do. And I want to say one thing about that. Caregiving is hard. You're living his life, you know, and I have not found that balance yet, to be honest. It's really hard. You do lose yourself. But here's the joy, and here's the wonderful thing, that we have a whole new relationship. We have a better relationship because we are working together. We have had to learn, we've had to rebuild our life, but we've had to learn to trust one another. We've had to learn to be flexible and loving enough to give up our old roles and adapt and change. You know, that for my end, yeah, I'm taking on a lot and I get stressed out that way. But for Mike, you know, as he loses his cognitive functioning, what does he do? You know, so how can he stay busy? What does he do? Bless his heart, he never stops learning, he never stops doing, he never stops contributing. From the littlest things that make a huge difference, like I never have a dirty dish in the sink, I never have full trash cans.
I didn't do that, I wouldn't have a job.
He's sweeping the floor. But the other thing is,
throwing the dishes away.
But here are the other little things. That he brings me tea every night. He turns down the bed at night. So we've had a flip-flop of roles, but there's a beauty in that journey together.
It's great that you're a team, but I will just, and we'll turn to Karen. I just have to say, having followed a bunch of patients, I'm an internist also, that in the caregiving life, nobody can do it alone. Nobody. And I think so many of my patients, and also somebody we followed for 10 years for 60 minutes, just that journey of finally getting to the point and saying, I gotta get some help. And the sooner people realize that, the better. So, Karen, is it Zegel? Am I pronouncing that right? Zegel. I had a 50-50 chance. Sorry. All right, Karen Zegel. Karen Zegel formed the Patrick Risha CTE Awareness Foundation, stopcte.org, following the death by suicide at age 32 of her son Patrick, who was a standout high school star and went on to play for Dartmouth College. Examinations of Patrick's brain at the University of Pittsburgh and BU revealed CTE. A key mission of the foundation is to provide parents of school-aged children with information about the dangers of sports and activities that may involve head trauma, such as football, etc. Karen has testified before the House Energy and Commerce Committee on youth sports injuries and concussion risk. Karen,
thank you.
Talk to us.
Well, I want to tell you a little bit about Patrick and about the Patrick Risha CTE Awareness Foundation and our website, Stop CTE. Now, every mother thinks that their son is the most handsome and the most intelligent human being on the world, and in my case, it was true. Patrick was such a delight. He was such a joy to raise. He started liking football at the age of 10. He was obsessed with it, loved it, and he became a great running back. The high school team went 2 years in the playoffs thanks to him. Everywhere in town, he got free cheeseburgers. He was a hometown hero. And he had a lot of records in high school, and those records are still there today. He was very happy and proud, and really wanted a Ivy League education. And so when Dartmouth recruited him, we were so excited and thrilled. Now fast forward 4 years later, he graduates from Dartmouth, he comes home, and we were so proud. We thought there was nothing Patrick couldn't do or achieve. But the Patrick we got home from Dartmouth was not the Patrick we had sent to Dartmouth. He was angry a lot. He was reclusive. He was depressed. He was anxious, sometimes oblivious to the whole world around him. He was dysfunctional at times. And he had no self-esteem, which was very surprising. Now, Patrick had a lot of bright spots. He could really pull it together sometimes. He had lots of friends. He had a son he adored. He had a family that loved him, and he loved playing golf. But his brain was failing him quickly. Over the next 10 years, we watched his beautiful mind deteriorate, and we call it becoming unwired. We started to see a kind of scared and distant look in his eyes. And he started forgetting everything. He forgot how to sign his name. He forgot how to tie his shoelaces. Patrick ended up having almost every mental symptom you could imagine. He would have weird verbal outbursts at the most inappropriate times. He would stumble and he would fall and he would slur his words sometimes. He would have headaches, and then he would have pains and spasms that would go all around his body with no explanation. But the scariest symptom for us, and you alluded to this a little bit, was the lack of sleep. He would go 3 days without sleep. I have trouble with 1 day. Imagine 3 days without sleep. And then you combine that with their depression, their irrational thinking. It's like a recipe for disaster. And we feel that's when the suicidal thinking comes in, and Patrick went through that door. And like you said, he was 32 years old. Patrick wasn't an NFL player. And the reason we started the foundation StopCTE.org was to help people recognize the disease. No one saw Patrick's disease until the very end. Heartbreakingly, he suffered with the disease for a very long time, and we saw the symptoms, but nobody could tell us what it was. He saw doctors, rehab centers, psychologists, counselors. They all misdiagnosed Patrick. First, they said he had audio processing disorder. Then they said adult ADHD. Then it was intermittent explosive disorder. Then it was depression. And then it was PTSD, of all things. When we took Patrick to a Philadelphia area concussion doctor, thinking maybe it was because of the football history, he listened to Patrick's disjointed talk for about 10 minutes, and he said, "This has nothing to do with concussions. This is all drug addiction related. So what our ask is and what we hope for with our foundation and our support of all these wonderful people that do what they do. We want families of veterans, we want families of contact sport athletes, and we want families of domestic abuse victims to be able to know that their person that seems to be changing and the person that maybe is going off the rails, that they are maybe dealing with a physical disease and not just a psychological problem. When it comes to CTE, I'm jumping all over the place, we feel that CTE may be the biggest problem this country has. We just don't know we have it yet. And there are scientists that say the cases we have to date, which are pretty many, may be just the tip of the iceberg. So what that means is that we have so many people with CTE that we're not even recognizing. So many people out there. You might think of it with the NFL players, but what about the college players and the high school players? It's been proven to affect them. We have such an epidemic in my mind that and I'm so just happy that we're so close to a diagnosis, because families don't recognize it, communities don't recognize it, and their own individuals don't recognize what's happening to them.
Thank you.